Hello, welcome back. The topic today is incisional hernia. We all know what in the previous videos about hernia. What is incisional hernia? Incision means cut, usually a surgical cut. Hernia that are occurring in the previous surgery site is called incisional hernia. It can happen any time, immediately or even after years of surgery, like 18 years, 20 years. After that, open surgery, it can happen. So generally, people, the patients come and say, I underwent cesarean for my last child 18 years back. Now I have some pain and swelling in that operated site. So this is how they give the history. So hernia is nothing but we all know a defect. Incisional hernia, a defect has reoccur in the previously operated site. So again, it cannot happen to everyone. Of course, it can happen to anyone, but it can be preventable. Who can easily get these kind of things? What are the factors? The first and foremost is the surgical site or the wound. If the wound is not healing well, especially infection, so surgical wound infection is the prime reason for the hernia formation. So the naturally any surgery, when the wound is healing, the maximum strength the tissue can gain is 70 to 80 percentage. So there is always a weakness. So if the wound is also getting infected, after months or even after years, hernia can happen. Or the surgical site has some collection, hematoma, blood collection. All these things can cause in the later stage hernia. The second part is the patient himself. Suppose the patient is obese. Again, we all know obese people are, because of too much of fat and everything. So they can easily get infection or dehiscence. Because of that, hernia can happen. Or the same way, a very thin individual or malnourished individuals without, a muscle mass. They don't have any muscle mass, undernourished, underweight. These can also get this kind of this thing. The third, suppose the patient is nutritionally anemic, or they have a protein deficiency, or they have a diabetes. These things can cause delayed wound healing or wound dehiscence and hernia formation. The third is whatever the thing that increases intra-abdomen pressure, like after the surgery, suppose they are straining for motion or they are lifting weights. That is why most of the open surgeries, doctors advise for the next 3 months or even 6 months, don't do bending, weightlifting, heavy work, avoid cough, constipation, all these things. So anything that can cause hernia, same. So bending, weightlifting, hard work, or pushing for motion, asthma, wheezing, cough, sneezing, or even prostate, you push for the urine. These are the intra-abdominal pressure when increases that can cause hernia formation immediately or even very later stage. And other things like diseases of the patient, suppose they have a diabetes, again chance of infection, nutrition deficiency, smoking, alcohol, even other diseases. Suppose they are taking medicines for rheumatoid arthritis like steroid, they are on steroid, or they are on chemotherapy. So these things can prevent the wound healing and promote dehiscence and hernia formation. Of course, smoking and alcohol is very bad for the wound healing because the fibroblasts they cannot mature, so wound will not heal that properly. Even nutrition deficiencies, after the surgery, their nutrition deficiency, or even before the surgery, they have a nutrition deficiency. They can get delayed wound healing and hernia formation. And even the type of surgery, suppose the surgery is done as an emergency, or the surgery involves resection and anastomosis of the intestines are cut and joined, so chances of infection, or in an emergency, the technique, availability of materials, all these things, the approximation of the tissues, or if they are poor, then they can get easy, or the approximation, like very tight, under tension repair, or suppose it's sometimes it's very difficult to close the abdomen. These are the other reasons they can get incisional hernia. Incisional hernia, of course, the patient will say, I have some pain or swelling, a gurgling sound, or even a lump, something moving, ball rolling, moving something in the previous operated site, in the scar. When I get up, I see a swelling. When I lie down, it disappears. Or sometimes they'll have a ball rolling movement, constipation, even vomiting. These are the signs for the incisional hernia. And of course, like any other hernia, doctors will examine, do investigations, sometimes ultrasound, CT scan, and come to a conclusion. These are the reasons for the hernia. So probably they need surgery. Mostly nowadays, all surgeries are done except mostly cesarean by laparoscopically or robotically. So the chance of, though the chances are very less, but still because of other factors, still there is a possibility of incisional hernia. So hernia needs surgery. Again, incisional hernia, most of the surgeons will try to avoid again an open surgery because already it's open surgery. The strength is only 80%. Now again opening on the same side, it makes it more weaker and more adhesion formation. So they try to do laparoscopically or robotically, and most of the time it fails and they may require open surgery. Like any other surgery, post-operatively the same care. Avoid bending, constipation, cough, weightlifting, sitting on the floor, avoid yoga. All these things to be carefully, at least with experience, we say 4 to 6 months, and you have to wear a belt. That is very important. Thank you.